Hello everyone. The topic for this session is paranasal sinuses and pterygopalatine fossa. The paranasal sinuses are air-filled spaces present within the bones around the nasal cavities. There are four paranasal air sinuses. They are the frontal sinus, maxillary sinus, the sphenoidal sinus and the ethmoidal sinus. All of them open into the nasal cavity through its lateral wall. The functions of the sinuses: it makes the skull lighter, warm up and humidify inspired air and add resonance to the voice. The frontal sinus: it lies in the frontal bone deep to the superciliary arch. It extends above the medial end of the eyebrows and backwards into the medial part of the roof of the orbit. It opens into the middle meatus of the nose at the anterior end of the hiatus semilunaris. The average height and width is about 2.5 centimeter, and the sinuses are better developed in males. The arterial supply is by supraorbital artery. The venous drainage is by supraorbital and the superior ophthalmic veins. The lymphatic drainage is to the submandibular nodes. The nerve supply is by the supraorbital nerve. Maxillary sinus: it lies in the body of the maxilla and it is the largest sinus. It is pyramidal in shape and opens into the middle meatus of the nose in the lower part of the hiatus semilunaris. The size of the sinus varies. The average height is about 3.5 centimeter. The width is 2.5 centimeter. And the anterior posteriorly it measures about 3.5 centimeter. The roof is formed by the floor of the orbit, and the floor is formed by the alveolar process of maxilla. It lies 1 centimeter below the floor of the nasal cavity, and it shows some conical elevations which is produced by the root of the molar and the premolars of the upper jaw. And this is the first paranasal sinus to develop. The arterial supply is by the facial artery, the infraorbital and the greater palatine arteries. The venous drainage is by facial vein, the pterygoid plexus of veins. The lymphatic drainage is to the submandibular nodes. The maxillary sinus, the nerve supply is by posterior superior alveolar branches from the maxillary nerve and the anterior superior middle superior branches from the infraorbital nerve. The sphenoidal sinuses, they lie within the body of the sphenoid bone and they are separated by a septum. Both are unequal in size and opens into the sphenoethmoidal recess. It is related superiorly to the optic chiasma and the hypophysis cerebri. Laterally, it is related to the internal carotid artery and the cavernous sinus. The blood supply is by posterior ethmoidal artery and the internal carotid artery. The venous drainage is through the pterygoid venous plexus and the cavernous sinus. The nerve supply is by posterior ethmoidal nerve and the orbital branch of pterygopalatine ganglion. The lymphatic drainage is by retropharyngeal nodes. The ethmoidal sinus, they are small intercommunicating spaces lie within the labyrinth of the ethmoid bone. They are completed from above by the orbital plate of frontal bone, from behind by the sphenoidal conchae and the orbital process of palatine bone, anteriorly by the lacrimal bone. They are divided into three groups: the anterior ethmoidal sinus, middle ethmoidal sinus and the posterior ethmoidal sinus. The anterior ethmoidal sinus, they are 1 to 11 air cells and opens into the anterior part of the hiatus semilunaris of the nose. The middle ethmoidal sinus, it includes 1 to 7 air cells and opens into the ethmoidal bulla in the middle meatus of the nose. The posterior ethmoidal sinus consists of 1 to 7 air cells and opens into the superior meatus of the nose. The blood supply and the nerve supply of the anterior and the middle ethmoidal sinus is by the anterior ethmoidal nerve and the vessels, and the posterior ethmoidal sinus is supplied by the posterior ethmoidal nerve and the vessels. The lymphatic drainage, the anterior and the middle ethmoidal sinus drains into submandibular nodes and the posterior ethmoidal sinus drains into retropharyngeal nodes. So, in this diagram we can observe the openings of the sinuses. The frontal sinus opens into the anterior aspect of the hiatus semilunaris. Here it is depicted by the blue color arrow. The maxillary sinus opens into the posterior aspect of the hiatus semilunaris. Here it is depicted by the green color arrow. The sphenoidal sinus opens into the sphenoethmoidal recess just above the superior concha, and the posterior ethmoidal sinus opens into the superior meatus. The development of the sinuses starts at about 12th week and it develops as a diverticulae from the walls of the nasal cavities. They grow into the surrounding bones, namely the frontal, ethmoid, maxilla and the sphenoid, and named according to them, and become air filled. The primitive openings of the diverticulae persist as orifices of the adult sinuses. The lining of the sinuses is ectodermal in origin, and all the sinuses begin to develop before birth except the frontal sinus. The maxillary sinus is the first to develop during 3rd month of intrauterine life. The frontal sinus develops by 5th or 6th postnatal year, and they reach their maximum size at puberty. The clinical anatomy. The infection of the sinus is known as the sinusitis. It causes headache, persistent thick purulent discharge from the nose. The diagnosis is made by transillumination and the radiography. In the radiography, the diseased sinus appears opaque. So, the maxillary sinus is the most commonly involved. So, the X-ray, we can see the maxillary sinusitis in Waters view, and in this X-ray we can make out the maxillary sinusitis. So, the maxillary sinus is common because it may be infected from the nose or from the caries tooth. So, the drainage of the sinus is difficult because its ostium lies at a higher level than its floor. So, surgically it should be drained, making an artificial opening near the floor by different methods. So, one method is the antrum puncture. It can be done by breaking the lateral wall of the inferior meatus and pushing in fluid and letting it drain through the natural orifice with head in dependent position. Or we can do the Cordwell operation. Here an opening can be made at the canine fossa through the vestibule of the mouth deep to the upper lip. Now we will discuss about pterygopalatine fossa. It is a pyramidal space present deeply below the apex of the orbit. The boundaries: anteriorly it is bounded by superomedial part of the infratemporal surface of the maxilla. Posteriorly, the root of the pterygoid process and the adjoining anterior surface of the greater wing of the sphenoid bone. Medially, the perpendicular plate of the palatine bone. Laterally, the opens into the infratemporal fossa through pterygomaxillary fissure. Inferiorly, it is closed by the pyramidal process of palatine bone in the angle between maxilla and the pterygoid process. Superiorly, it is formed by the undersurface of the body of the sphenoid bone. So, the communication of the pterygopalatine fossa, it communicates through the inferior orbital fissure with the orbit, the pterygomaxillary fissure to the infratemporal fossa. Through the sphenopalatine foramen, it communicates with the nasal cavity, and through the foramen rotundum, it communicates with the middle cranial fossa, and through the pharyngeal canal, it communicates with the nasopharynx, and through the Vidian canal, it communicates with the foramen lacerum, and through the greater and lesser palatine canal, it communicates with the oral cavity. The contents of the pterygopalatine fossa includes the third part of maxillary artery and its branches, the maxillary nerve and its branches, pterygopalatine ganglion and its branches. Now, we will discuss about the pterygopalatine ganglion. It is the largest parasympathetic peripheral ganglion. It is the relay station for the secretomotor fibers to the lacrimal gland, mucous gland of nose, the paranasal sinuses, the palate and the pharynx. It is topographically related to maxillary nerve and functionally connected to facial nerve through the greater petrosal branch, and it is situated in the pterygopalatine fossa, below the maxillary nerve, in front of the pterygoid canal and lateral to the sphenopalatine canal. The connections: it is having the parasympathetic root, the sympathetic root and the sensory roots. The parasympathetic root or the motor root is formed by the nerve of the pterygoid canal. So, the parasympathetic root derived from the nerve of the pterygoid canal. The preganglionic fibers rises from the lacrimatory nucleus of the lower pons, then successively passes through the nervus intermedius, the trunk and geniculate ganglion of the facial nerve, the greater petrosal nerve, the nerve to pterygoid canal, and finally relays in the pterygopalatine ganglion. So, the postganglionic secretomotor fibers supplies the lacrimal gland, the nasal glands, the palatine glands and the pharyngeal glands. The sympathetic root is also derived from the nerve of the pterygoid canal. It contains the postganglionic fibers arising in the superior cervical sympathetic ganglion, which passes through the internal carotid plexus, the deep petrosal nerve, the nerve of the pterygoid canal, and reaches the pterygopalatine ganglion. So, the fibers pass through the ganglion without relay and supply the vasomotor nerves to the mucous membrane of the nose, the palate and the nasopharynx. The sensory route comes from the maxillary nerve. Its fibers passes through the ganglion without relay and they emerge in the branches. The branches are the orbital branch runs through the inferior orbital fissure, supplies the orbital periosteum and orbitalis muscle. The greater palatine branch descends through the greater palatine canal and comes out through the greater palatine foramen. It supplies the mucous membrane of hard palate and labial aspect of upper gums. The lesser palatine branch descends through the greater palatine canal and comes out through the lesser palatine foramen. It supplies the mucous membrane of soft palate, uvula and tonsil. The nasopalatine, that is medial branch, the longest of it is called as the long sphenopalatine branch. It runs through the sphenopalatine foramen to reach the nasal septum and then runs through the incisive canal to come out the median incisive foramen. It supplies the nasal septum and the gum of the incisors. The posterior superior lateral nasal, also known as the short sphenopalatine, it runs through the sphenopalatine foramen to reach the nasal septum and supplies the upper posterior part of the lateral wall of the nose. The pharyngeal branch, it runs through the palatovaginal canal and supplies the nasopharynx. So, diagrammatically, we can represent the pterygopalatine ganglion and its branches, the orbital branch, the greater palatine branch, the lesser palatine branch, the posterior superior lateral nasal branch, the posterior superior medial nasal branch, the longest of it is represented as nasopalatine nerve, the pharyngeal branch that passes through the palatovaginal canal. Clinical anatomy. The pterygopalatine ganglion, if irritated or infected, causes congestion of the glands of palate and the nose, including the lacrimal gland. It produces running nose and lacrimation and it is called as the hay fever. The ganglion is called the ganglion of hay fever. The questions for assignment: classify paranasal air sinuses, add a note on maxillary air sinus. The pterygopalatine fossa, the boundaries and contents, the pterygopalatine ganglion. Thank you.